Throughout February, March and April, Be Clear on Cancer are going to be focusing on a number of cancers: lung cancer, ovarian cancer and breast cancer in women over 70. I'm here with Dr. Steven Elliot, Clinical Lead for Cancer at Salford CCG, to talk about these three cancers and the symptoms that people should look out for. We're currently in the middle of a national campaign promoting general awareness of ovarian and breast cancer. What are the main symptoms and causes that women should look out for?
With respect to ovarian cancer, the big awareness that we want to promote is really around the symptom of bloating. So if a woman feels bloated within a stomach, within her abdomen, most days or every day over a 3-week period, then she should go and see a doctor. And she can have an assessment which will probably involve a very simple blood test which might indicate whether it's necessary for her to have further tests. Other symptoms that a woman with ovarian cancer might experience might be feeling full. So when she's eating her food, she feels full quickly. This might be associated with loss of appetite. Other symptoms might include pain within her stomach or within her pelvis, and perhaps increased frequency of passing urine. In terms of the symptoms that a lady with breast cancer might have, I think everybody's aware that a lump is a symptom, but there's a variety of other symptoms which ladies need to think about. In essence, any change affecting one breast is something which you need to consider seeing your doctor about. So things which might happen, which might possibly indicate the start of a cancer, might be increased size of a breast, or some pain, or perhaps some discharge from a nipple.
Are women of a certain age more susceptible to these cancers than others, or do they affect women of all ages?
In ovarian cancer, we are particularly keen that women over the age of 50 go to the doctors quickly, as that's the group who are at particular risk. In terms of breast cancer can occur at any age, but actually does become more common as you get older, and 1 in 3 cancers actually occur in ladies over the age of 70.
In March, we'll see a campaign being launched to generate greater awareness of lung cancer. What are the main symptoms and causes of lung cancer that people should look out for?
Lung cancer does occur in people who don't smoke, but the vast majority of people with lung cancer do smoke, so smokers are of particular risk. The other group of people that we're keen to promote awareness of are people who have been exposed to asbestos, so people who have worked with asbestos, people who have been in contact with it. Those people also are at high risk. In terms of the sort of symptoms that a person with lung cancer might have, the commonest probably would be a persistent cough, so a cough that goes on for longer than 3 weeks. Other symptoms might include coughing up blood, unexplained weight loss, hoarseness, and shortness of breath. Lung cancer can cause chest pain and shoulder pain. People at particular risk are those who have already got a lung condition, such as chronic obstructive lung disease. People like that whose symptoms change, in particular if they experience increased shortness of breath or exacerbation of their symptoms over 3 weeks, they again should consult their doctor as a matter of urgency.
Are there any lifestyle tips that people should take on board to reduce the risk of getting any of these cancers?
In general terms, the risk factors for all types of cancers are smoking, alcohol, obesity, diet and exercise.
In April, a campaign has been launched in Salford to generate greater awareness of bowel cancer and bowel cancer screening. What is bowel cancer screening and why is it so important?
The bowel cancer screening programme concentrates on people between the ages of 60 and 69, and every 2 years they send a simple kit, a little bit embarrassing, you've got to poo into it and then send it back to a laboratory. And what we're looking for is something called occult blood. That's blood which is only seen through doing a special test, and the significance of this is that in early bowel cancer might be bleeding very slightly into the bowel. Now, if you do this test and it's found, and some blood is found, then you will be offered a consultation with a nurse who will explain the concerns around this. And it might lead on to a test called colonoscopy, a special examination of the large bowel. The really good thing about this is that it doesn't just only catch early cancers, but it also picks up conditions which can lead on to cancer before cancer develops, things like some sort of polyps which can be removed and then can avoid you actually developing the disease. The real, I think the take-home message for people within Salford is that cancer is no longer a death sentence. I myself was actually diagnosed with a life-threatening form of cancer 2 years ago, and the tests and the treatment weren't particularly pleasant, but I am now able to look forward to a healthy, active, long life. Sadly, within Salford, people do tend to present a little bit late, and because of that, it can be difficult to treat. So the message is, get yourself checked out, don't be scared. Cancer is treatable,